Hey everyone, this is Dr. Jamie with True Health Chiropractic, and tonight we are talking about how to become a cancer killer and cancer prevention. This is always really the topic in November, especially aimed around breast cancer. So, this couldn't come at a better time to really talk about how not only to kill cancer, but most importantly, how to prevent it. So, I want to cover a couple of stats right now. A lot of people are not aware of just really honestly how devastating cancer still is in our country. And in fact, 1 in 2 men and 1 in 3 women are projected to develop cancer at some point in their life. Cancer is also still the leading cause of death from disease among U.S. children over 1 year of age. In 2017, there were over 1.6 million new cancer cases and over 600,000 cancer deaths. In 2021, there have been over 1.8 million new cancer cases and almost 610,000 deaths. So the problem is not getting better. The rate of new childhood cancer cases, including leukemia, has steadily increased over the last 40 years. And the global cancer cases are expected to rise by more than 75 to 93% by the year 2030. So the war on cancer started back with President Nixon back in 1971. The sad state is, though, we've lost the war, and it only continues to rise and continue to get worse. So we are not winning this battle. And again, really the answer is not waiting until we're sick, it's preventing it. And that is what the medical system has never been good at, is never teaching us how to actually prevent disease. The whole medical model is waiting till you have symptoms and then reacting. So epigenetics tells us that, really thinking about our environment, and the reality is that your cells thrive in a healthy environment, and they have to have a healthy environment in order to do this. So think of, when you're thinking about your environment inside your body, think of a green pasture on one side and a garbage dump on the other. And see how in the green pasture, everything is doing exactly what it's supposed to do. It's vibrant, it's strong, it's thriving, it's healthy. It doesn't attract rats, rodents, maggots, flies, or buzzards. But see the garbage dump. It's filled with trash, and it attracts all kinds of pests. Pests thrive on garbage, and the ground is sick. You can go in, you can shoot the buzzards, you can poison the rodents and the maggots, you can swat the flies, but they'll always return because you didn't take care of the source of the issue, which is the trash. Until you go in and remove the trash, life will never thrive. Your body's the same. If you don't clean up the trash, disease and sickness will be there and more disease will appear. In fact, if the rodents, flies, and maggots go to the green pasture just across the street, they'll soon find out there's nothing for them to live on and they'll return to the dump. If you clean up the garbage and trash, you can plant a thriving green pasture free of disease and sickness. Your body is made of thousands of genes, and 3 million base pairs within your DNA are all interacting. When you've created a healthy environment or ecology, your epigenetics are in balance. In the wrong environment, the DNA in your trillions of cells gets out of balance and start producing disease rather than health. So, the study of epigenetics tells us that through our environment, we can control and turn on good genes and turn off bad genes. So, through our environment and how our nervous system is functioning, through toxicity in our environment, the air we're breathing, products we're using on our skin and our hair and nails, the food that we're eating, pesticides, herbicides, diet and nutrition sufficiency, the fitness level that we have, and stress. So, waiting until it's too late. When do symptoms actually show up? What I want you to realize is when you look at this chart, that even Harvard had done this study that most symptoms or most diseases, you will not start to develop symptoms until you're at 60% function or less in that organ, tissue, or cell. So what the symptoms are not the main problem. Symptoms are just warning signs of an underlying disease pattern. That's why we shouldn't wait until we have symptoms to then actually treat an illness. We need to prevent the illness in the first place. So the truth, a lot of people, especially when we talk about cancer, people think that you get cancer and then you get sick. The truth is, you were already sick and then you got cancer. And this goes for every single disease out there. Again, the goal should be to get yourself healthy before a disease ever appears. We don't have to wait until cancer, heart disease, diabetes, or headaches ever show up. D.D. Palmer was the founder of chiropractic, and this was a quote by him that there's a vast difference between treating effects and actually adjusting the cause. He wanted to know why. Why does one person who sits at the same table, works in the same shop, and sits on the same bench have a disease, but the person they're sitting right next to not? Why is this? What difference was there in these two persons that caused one to have various diseases while his partner escaped? Why is it that two people, even two family members with the same DNA, could sit in the same office space, one gets sick and the other not? What's the difference? Have you ever known somebody too that looked good, exercised, ate right, still got cancer, had it at a young age, and maybe even died? And have you ever known somebody that smoked, drank, ate what he or she wanted to, and they still lived it to be 90? And it's almost like everybody's got that one uncle that just won't die. Again, what is the difference? And that's what Dee Dee, the founder of chiropractic, was searching for. Siamese twins Masha and Dasha. The girls were born in the 1950s. They were joined at the spine at an angle of 180 degrees. Between them, they possessed 4 arms, 3 legs, a separate small intestine, but they shared the same colon and rectum. They had 4 kidneys, but only 1 bladder, along with a shared reproductive system. Their circulatory system was interconnected. They shared the same blood supply. They had separate spines. This meant they each had their own central nervous system. Masha and Dasha shared the same circulation system. To understand the importance of this, we need to turn the clock back more than 100 years ago with Louis Pasteur, who was trumpeted as the father of the germ theory. The notion that bacteria causes disease has become the foundational stone of modern medicine. Bernard had a different view. He said germs flock to the site as a signal disease existed. They were not the cause. To look for the reason, we need to examine the environment. Some say Pasteur actually changed his mind on his deathbed, claiming it was the territory and not the bug which was the cause of disease. However, by that time it was too late. The germ theory had taken off, and it was about to give rise to a $1 billion+ pharmaceutical industry. The Russian experimenters on the Siamese twins, Masha and Dasha, found irrefutable evidence that Bernard was right and the germ theory wrong. These girls shared the same blood. They did not get the same illnesses. During childhood, one twin got measles, the other did not. How is this possible? Surely the same germs were shared by both of them, and yet only one was affected. This phenomenon occurred repeatedly. One girl got a cold, the other remained healthy. One got the flu, the other didn't. Dasha was given to immune weakness. She was right-handed and short-sighted. Her sister became a smoker, later developed a taste for alcohol, had high blood pressure, had clear vision, and was left-handed. In reality, 2 different people shared the same blood supply. How could this be? They had shared blood, had a common digestive, excretory, endocrine, skeletal system, but did not go 50-50 on the same illnesses. The key to understanding this lies in the fact that they had separate nervous systems. They both experienced an individual emotional environment. This fit into Bernard's theory, which stated that diseases are not caught by breathing in germs, but come about by emotions that cause stress at the brain level, thus weakening the system and providing a place where germs can live. A bacterium looks for its natural habitat, which is abnormal tissue. The microbes are the result and not the cause, and fulfill their real purpose, which is to heal by breaking down illnesses. So this is the key. Your nervous system is everything. It is the missing link. It's the key ingredient. And it's not just for health, for thoughts, emotions, feelings, goals, aspiration, healing, hormones, etc. Every single thing is controlled by the nervous system. You can activate your cancer killing systems into high gear because your nervous system releases interleukin 2. And the fact remains that chiropractic adjustments temporarily influence the release of interleukin 2 following just a single adjustment. This is why we say that when you get adjusted, it actually does help to boost your immune system. And that is the power of chiropractic adjustment, because remember, the spine protects the nervous system. The brain, spinal cord, and nerve roots are protected by the spinal column and the skull. We also need to look at diet and nutrient sufficiency. We need to embrace prevention. No one thinks it's going to be them. That's just the model that everybody has. But you can't live that way. The Mediterranean diet has been studied in numerous studies, and it has been found to be one of the best diets in order to prevent and cure cancer. There was a study done on 808 individuals aging from the ranges 40 to 70 years old, and they cut their cancer risk in half. They avoided inflammation caused by saturated fat. There was a high use of fruits, vegetables, legumes, nuts and seeds, whole grains, fish, and poultry. A high ratio of healthy fat to saturated fat, low use of alcohol and soft drinks. They avoided processed meats and sugar. The foods primarily improve the microbiome, basically the gut health, by eating a lot of prebiotic foods. And naturally, the diet is lower glycemic, which reduces the insulin load on the body. The standard American diet is an anti-Mediterranean diet. It's the exact opposite. It is high glycemic, very low fiber. It's got tons of processed red meats, eggs and dairy, refined grains and flours, vegetable, nuts and seeds, oils, hydrogenated oils, soft drinks and alcohol, additives, and artificial sweeteners. This is a list of foods that have anti-angiogenic properties. What angiogenesis is the transition of benign tumors becoming malignant by actually being able to create new blood supply. These foods, which are also very high in a Mediterranean style diet, actually help to prevent this new generation of blood in tumor cells. Green tea, red wine, olive oil, bok choy, kale, cucumber, artichoke, garlic, tomato, cherries, oranges, blueberries, blackberries, strawberries. Many of the foods we have talked about in numerous different aspects, whether it's for arthritis, inflammation, leaky gut, cancer, boost your immune system. You're going to consistently see these foods again and again and again. They are the most highly studied foods that, again, show they actually do have preventative and cancer killing properties and agents to them. So the cancer igniter is inflammation. This is the underlying issue with any disease process. And the big triggers in our American diet are sugar and grains, the vegetable oils, common allergens like casein and gluten, and then excess cortisol from stress and poor sleep. So the fats that are in a standard American diet are very high in omega-6s. This is an essential fatty acid. However, it has inflammatory properties to it. Casein and gluten are actually proteins found in dairy and wheat, and they are very quick to spark your inflammatory cascades. Sugar literally feeds cancer. And a great example of this is if you've ever known anybody who's had a PET scan. They are literally injected with a sugary dye because cancer cells have an affinity for sugar. that dye goes right to where the cancerous cells are. It lights up, and they can see it easier on the scan that they perform. So we know that cancer thrives in a sugary, acidic, non-oxygenated environment. Cancer cells are glucose metabolizers, and they actually too will raise your insulin levels again, which is also a major source of inflammation. Insulin will cause you to age quicker, cause wrinkles, achy, painful joints. It'll cause you to hold weight, not be able to lose weight. And so there's many inflammatory factors towards insulin. Sugar is also an anti-nutrient, which causes nutrients not to be able to get into your cells. Toxins now can't get out of your cells, and your cells become hypoxic and can turn into cancer cells. Studies show that your C-reactive protein levels also can cause cancer. Chronic inflammation and an elevated CRP have an actual causal role in the growth of cancer cells. And there's been numerous studies that also show that this high level of CRP can create oxidative damage to cells, again, leading to cancerous growth and promote the growth and spread of cancer cells. That's also too, you can get your C-reactive protein tested. It's not a very expensive test, but it's something that is really crucial to really know if you have higher levels of inflammation in the blood and body. So optimal omega is the healthy omega supplement that we carry in the office. And the reason that we carry this omega is because it's in the correct ratio. So cellular inflammation is actually caused by a higher ratio of omega-6 fats to omega-3. The healthy natural ratio that our cells thrive in is a 3 to 4 to 1 ratio. However, the standard American diet and the modern ratio is anywhere from 30 to 50 to 1. So again, the standard American diet is pro-inflammatory. So we want to reduce inflammation, which therefore decreases our risk of cancer and other diseases. Another product that's really good you can take this in a supplement form. You could also eat this, but is turmeric. The active ingredient curcumin is the orange colored spice native to India and Indonesia, and it's used for its culinary and therapeutic benefits. Turmeric is what gives curry its bright yellow or orange color, and it contributes to the peppery, kind of like a little bit bittery taste. It also produces a ginger-like fragrance. Turmeric's active ingredient is an extracted compound called curcumin, and studies have shown that curcumin helps prevent several forms of cancer, including breast, lung, stomach, liver, colon, because of its anti-inflammatory and antioxidant properties. It stops the development of cancer by interfering with the cellular signaling aspects of the chronic disease. And they have also found in lab studies that curcumin is capable of inhibiting the COX-2 enzyme that creates negative inflammation, which can lead to cancer. It also impedes vascular epithelial growth to starve cancer cells of their oxygen and their fuel source. It induces a tumor suppressor gene. It can literally stop metastasis, which is the spread from one organ to another. And it also prevents regrowth of cancer stem cells. This is all based on a 2011 study conducted by the University of Texas. So again, this is something to cook with. If you take the supplement, you'd want to be taking upwards of 100 plus. Some sources even have 1,000 milligrams in them. The men and women's multivitamin that we carry also contains not just a classic kind of like multivitamin and mineral complex, but the key is that it also contains antioxidants and has anti-inflammatory procellular effects to it, because the women's and men's have different antioxidants in them, ones that are better for breast health, ovarian health, whereas the men's have things that are better for the male reproductive system, the prostate, and things like that. But overall, um, oxidation can lead to the expression of over 500 different genes and activate inflammatory pathways, leading to the transformation of a normal cell to a tumor cell. So we want to prevent oxidation. That is not a good thing to happen to our cells and tissues. So by taking and eating antioxidants that have anti-inflammatory properties, it keeps our cells nice and healthy and strong. There's also numerous evidence, and we've talked about this, from anything from brain health to Alzheimer's, dementia, gut health, bone health, joint health, is you've got to make sure your vitamin D levels are correct and sufficient. We see too many people that are low or even deficient on vitamin D. And research shows that this vitamin can literally help your body kill cancer cells. Within a few days, half the cancer cells shriveled up and died. The vitamin has the same effect as a drug actually used for breast cancer treatment. This was a research done out of New York by Joellen Welsh. She was also featured on ABC News and Good Morning America with the findings. The sun actually too, when the sun shines on your skin, it actually activates the vitamin D being produced by the cholesterol underneath your skin. This is why so many people are deficient in vitamin D, because of the number of people that take statins, which are cholesterol lowering drugs. You do not produce vitamin D when you take a statin lowering drug. So the key that vitamin D acts on, it acts on your T cells, which are part of your immune system. And these are able to literally find and seek out cancer cells and literally destroy and kill them. So it literally helps you to kill and destroy cancer cells. There are over 900 genes in your body that have vitamin D receptors and proteins that bind to vitamin D. So it helps regulate the expression of literally over 900 genes. That's why it supports your immune system, your pancreas, your heart, your blood, your cells, your muscles, bone marrow, breast, colon, intestine, kidney, lung, prostate, retina, skin, stomach, uterine, brain health. And it literally positively impacts 36 bodily organs. There is no reason to not be getting this tested and making sure your levels are sufficient. It also regulates your immunity. Research have actually found that vitamin D not only affects key cells of your immune system, but it plays a critical role in actually regulating immune system reactions. And then remember your gut health. We've been talking about this over the last few months, about how the gut is literally, it's your second brain. It is where the majority of your immune system is actually triggered and fired and stored. And it has over 100 trillion microorganisms. So gut flora actually help to protect us against infection. This is why when people take antibiotics, which kill off all the healthy and not healthy flora in the gut, they typically see that they wind up having a super infection or get a different type of infection. Like, let's say you're taking an antibiotic for an ear infection or a sinus infection, and then oftentimes, many times, women will wind up getting a yeast infection after they start the antibiotic or get off of it, because it kills off everything, and then the body begins to have this super growth of bacteria. Up to 80% of your immune system is located in the GI tract, and we talked in the past months about conditions such as leaky gut, in which toxins and medications and stress actually cause the gut lining to be leaking, where proteins and other food particles are then actually leaking into your bloodstream. That's why we do the food sensitivity testing in the office, so that we can actually see, so you don't have to guess about what foods may be creating not just stomach pain, gas, or bloating, but foods that you may actually be ingesting that are triggering your immune system to actually attack itself. Remember, when we're talking about cancer, the whole point is to, for one, prevent it. How do we prevent cancer? We got to have a titanium immune system. We got to make sure our immune system is functioning as best as it can. So let's remove all the triggers and stressors that we can. And that's one reason why, when we do the food sensitivity testing, we're checking common foods that are common irritants like dairy and gluten and wheat and sugar. We're testing these foods to see how the body and the immune system is actually reacting. Stress and cancer. Remember, this is another thing in our environment. Many of us are stressed, especially over the last couple of years with COVID and the pandemic. But stress affects everything, and everybody has stress. And it curtails energy production, it increases inflammation, it makes your body acidic, it reduces your immune system, it raises your blood pressure, it alters brain chemistry, disrupts your hormones, and it even makes you fat. And many people stress themselves out about things they don't even have any control over. Studies have shown that fear, anger, jealousy, and negative emotions produce acidity in the body, while positive emotions such as love, laughter, and joy produce an alkaline environment. And cancer cells cannot thrive in an alkaline environment. They do, however, thrive and grow and spread in an acidic, non-oxygenated environment. So stress also too causes the release of growth promoting hormones that switch cancer on and make it grow. In a 2010 study, they showed there was a 30-fold increase in the spread of cancer throughout the bodies of stressed mice compared to those that were not stressed. The reality is that stress can impact your body in a negative way. So you have to get the stress under control and realize there are many things that you obviously can't change and can't control. And so it is our reaction again to those things. Developing ways to positively be able to deal with the stress in your life through affirmations, through positive thinking, through prayer, through journaling, through support, friends and family members such as that. But that is how stress negatively impacts. It's mostly because of the hormones that are triggered and released, creating that non-oxygenated acidic environment. And the last thing is exercise. There is no reason that we can't move our bodies. Movement is life. Motion is life. If you don't use it, you lose it. Exercise literally reduces your risk of breast cancer up to 80% and colon cancer by up to 40%. Now, specifically, a lot of studies have been done on high intensity interval training, which can be done. You can see in the picture here anything from high knees to lifting weights to sliders to mountain climbers to just taking a brisk walk. But the key is you have to get your heart rate up. And that is the specific type of exercise. But again, just overall, moving and exercise also helps reduce stress, and it creates an oxygenated environment in your tissues and cells. Cancer cannot grow and it cannot thrive in an oxygenated environment, and that is the whole reason that you should be exercising, is because we've seen in numerous studies that it can literally decrease your risk of cancer by anywhere from 40 up to 80%. So if you have questions, please, you can email us at truehealthcairo@gmail.com. And please join us next month on Tuesday, November 2nd. We're going to be talking about how to build a titanium immune system, which just cascades right off of, if you've got a strong immune system, we know that you can prevent cancer and you can kill cancer. And that, remember, is that we want to create the environment that doesn't allow cancer to actually grow. And that's the whole reason we're talking about these particular things. Making sure your vitamin D levels are in check, making sure your nervous system and your spine are healthy and mobile and moving, making sure that you're taking great quality supplements that are giving your body the nutrients that it needs in order to be able to thrive, not just survive. I want to thank you guys for being with us. And please, like I said, if you have any questions, you can email us. Obviously, you can ask us in the office as well. But if you're not a patient, please do email us, or you can leave a comment if you're watching this on Facebook or YouTube, and we will answer your questions there. And we'll see you next month.